Good morning, Amelia.
Hey, Carrie, how are you?
Good, hon. We're just waiting for Jenny.
Okay. We're at the Grafton Health Fair. I'm here with Molly. Julius. We can't have it. We can't have it. We count on it. Work on it. Oh, it's, oh, change my mind. That never happens. What is it? And the prince. I invited you.
Good morning. Welcome to the Board of Health meeting for September 22nd, 2023. First item on the agenda is to approve the minutes from August 18th. Do I have a motion to approve?
So moved.
Do I have a second?
Second.
Do you approve?
Abraham, aye.
Aye.
Aye. Next item is review and discuss coronavirus updates from COVID-19.
Oh, no, they don't. Only public hearing.
Yes, good morning, everyone. I will ask my colleague, Ms. Amelia, Chief of Public Health Nursing, to provide an update. Amelia, are you on?
Yes, hi, everyone. As far as the COVID vaccine is concerned, it's out. And as far as our the city of Worcester is concerned, we are able to get vaccine for children, COVID formulation. So 18 years old and under is the vaccine that I have access to. at this point in time. We are also part of the Bridge Access Program, and that is if there's an underserved community with no insurance or if they're underinsured, I can also order vaccine for that population. So that's also something that we have access to. We haven't been too bad in Shrewsbury in terms of COVID cases. It hasn't been that bad in August. It's a controllable number, but of course we only know about the cases that are reported to the state through testing. We don't know about the tests that are done at home, which, you know, would increase the number significantly. That's really it in terms of the communicable diseases. We haven't had any TB lately. We did meet with Mike Devlin from SMOC the other day on a Zoom call to discuss the migrant families at Days Inn. We just reached out to say, hey, if you need any help with anything, we're here and who we are. So we're on standby if they need anything from the city. And I think that's it for now.
Do you know what brand of vaccine you're bringing in for the children?
If it's COVID, it's right now Pfizer and Moderna are out.
Right. So are you getting both for the children, or are you getting one or the other?
Well, that's a good question. I would probably try to get both.
The reason to ask the
'Cause I
question.
kn-
Sorry, the
Yeah,
reason to
go
ask
ahead.
the question is because children under 5, if it's Pfizer, it's a 3-dose series, while Moderna is a 2-dose series. So it will make some difference in terms of your allocation of staffing, resources, follow-up, or how these children get. So just something to think about as you think of children under 5. So that's sort of been a decision-making point in organizations bringing in one particular type of vaccine or the other. They're equivalent and interchangeable, but just staffing and the extra dose may add some staffing and other resource challenges that you may need to factor in to the equation.
Right, and if we schedule clinics like that, we would also need to schedule the return date, just to make sure we do have the staffing. So yes, you're
Precisely.
correct, thank you.
Exactly right. And Madam Chair, if I could add a few more comments, if up to you.
Certainly.
So just both hospitals had seen a sort of peak in August of COVID cases, which seem to be gradually coming down. We think it's primarily related to travel. A lot of people who traveled in July and August, and so a lot of this was probably disease acquired during travel from either domestically or internationally. And so that seems to be coming down. Clearly, there's still active disease. And as Amelia pointed out, what we measure is just the tip of the iceberg, because lots of people either test at home or don't test at all, and none of that is reported. And so therefore, I think there's more disease than we estimate. But by and large, the hope is people will take vaccine. There is not universal enthusiasm. People are just sort of vaccine shy, just from tired of having to go on taking vaccines. But I think we are sort of convincing people it's a reality, just like we take a flu shot, that there would be an annual COVID vaccine that we all may need to take. Questions were raised about whether this would be a combined vaccine this year, and as data showed, both vaccines attenuated each other's response, which meant that the COVID and flu responses were lower in the combined vaccine data. And so that's been shelved for this year. There is hope next year to have either a combination vaccine of either COVID and flu, or COVID, flu, and RSV, all 3 vaccines being combined as one. And so there's some work going on that right now. The Omicron strain, that was the other question of, there was this extremely virulent variant, the BA.2.86, which had about 32 mutations in its spike, and whether the vaccine would work. And I think there's eloquent data from multiple sites which have showed that that concern is no longer valid. That's not a fit set of mutations, and so therefore vaccine will work. So the XBB family, the Omicron family, should be well covered with the current vaccine we get. And so everyone is strongly encouraged to get. There is no recommendation for a second dose after, so it's a single dose. The CDC labels this as an updated vaccine, not a booster. That's because it's a monovalent vaccine now. It's not a combination vaccine. So in other words, it doesn't cover the original family of COVID, the Delta and the original variants at all. It only focuses on the Omicron. So it's essentially almost tooled as not a bivalent, but a monovalent vaccine. We're seeing sporadic flu activity, not a huge amount, and based on data from the southern hemisphere, which sort of tells us, so Australia, South America, etc., which our summer is their winter and vice versa, so their flu experience generally gives us a good prediction of where our flu activity prediction would be. Predominantly H1N1, no surprises. That's been in the vaccine for years, and so that's not changed. In adults, the efficacy was somewhere around 40 to 45%, which has traditionally been the years of good response rates, and so therefore that would be considered good. So meaning that the current formulation of vaccine this year should have a reasonably good response rate. And obviously, as people take it, there will be some degree of herd immunity, which we will accomplish. There are 2 RSV vaccines out. The concerns are always 3 vaccines to be taken in a season, and what's the chance that they'll induce some degree of vaccine hesitancy. And so the CDC has been actively pushing COVID and flu first, seeing those as bigger priorities, and then to take RSV after that, especially people 60 and older where RSV vaccine is indicated. And then on the infectious disease epidemics front, we've seen advisories from public health. There have been 3 West Nile virus cases in Massachusetts. One was from our county, Worcester County, which we took care of, and so acquired outside of the state. But so that continues to be a threat, and there's plenty of tripolline mosquitoes, not seen any human cases reported as of yet this year. But clearly infectious disease is still prevalent overall as a result of the summer-fall activity, and so something to be just vigilant about.
Great. Thank you, Dr. Abraham. What is the communication strategy to, I guess, the general public about the new vaccine that has come out?
To the chair, so we work with the State Department of Public Health through that process. Whenever we get the most updated information, we share it with the Alliance Towns, and so if there's any follow-up questions, we are available to ask those to answer those questions in terms of one of the best time to take the shots, or the side effect of the vaccine as well, but just any general questions. So
Okay, great. Thank you.
You're welcome.
And I did see the notice went out about the free test that will launch September 25th.
Monday.
Yep. So up to 4 free tests for a family,
Per
correct?
family.
yes.
Correct.
Excellent. In terms of the migrant population, I do believe we have some in our community, and I would love to hear how our town is addressing and supporting those families.
So I can speak to the work that from the inspectional services perspective. As Amelia alluded to, we had a meeting with the SMOC executive director this week to talk about ways we can collaborate with them whenever questions come about. And our focus is looking at how the place is ran in terms of the sanitation piece of it. It's very important that we make sure that family has all the necessary towels, cleaning tools, and stuff. So from that end, I believe it's an ongoing work, right? Nothing's perfect. I think meeting with Jim and his staff, they have shown us that they are doing the best, but as you know, these are families from a different culture, so it's taking them time to assimilate into the town. But we are planning on meeting with them constantly through that process, and understanding their needs and identifying resources to assist them through that process.
And is the town doing any support around food or clothing or anything like that, or is that primarily being handled by SMOC?
Well, I'm not too familiar with that process in terms of clothing. I will say that most of the residents that most of the migrant that's at the Days Inn has been vaccinated, and according to Mike, his team is working with the state. They had a mobile vaccination van at the hotel to vaccinate most of the folks that was there as well.
Mhm.
So in terms of clothing, I can speak to that, right? But that's something I can definitely look into that.
Okay, that'd be great. And Carrie, I'd love to hear from Mike about, and actually the superintendent, sort of about what the experience is happening in the schools as those kids are getting enrolled in schools. Because I know there's been a lot of concern about culturally appropriate foods and things like that, because it can interfere with concentration.
I mean, we can certainly reach out to Dr. Joe Sawyer, the superintendent, and see if we have any feedback, but I haven't heard anything about that. I know the town, when we originally had the migrants come into the community, the town put out multiple communications and still are soliciting donations from the public for diapers, wipes, any of those types of things. Our department donated several boxes of the COVID-19 tests that were left over from the state. And I had some digital thermometers that we donated as well. So the town continues to encourage people to make donations and make people feel welcome into our community.
And where can they drop off those donations?
There's a drop-off box that's out front of Town Hall, and
Great.
it's labeled. And there was one in the lobby too, but I think the main one is just out on the front, and it's labeled. And the town manager's office manages that and makes sure that nothing's left outside of the box.
Awesome. Great, thank you.
Yep.
Next item is to review and discuss updates from the Central Mass Regional Public Health Alliance.
Thank you, Madam Chair. Before I provide an update, I want to introduce two staff from the Alliance. Mr. In Wan, who is the new Division Deputy Director. Mr. Wan comes to us from Tufts Universities. And also Ms. Emma, who is the new Regional Environmental Health Inspector. Emma comes to us from the city of Worcester, have many years of doing inspectional services work.
Great, welcome both of you.
Yeah. In terms of environmental health inspection that has been done since August 18 to current, there's a sheet, you all have the sheet in front of you in terms of inspections. I must say that having Emma on board with her vast of experience, we are looking on standardizing a lot of our inspectional process and protocol moving forward. Emma and Devon, who is the other inspector, did some food truck inspection over the weekends. And so I must say that the process is fluid.
Mm-hmm.
Whenever we receive any complaints, Emma is looking into the complaints, and Emma is working with the residents and the carrier to address the complaints. In terms of other updates, the Alliance will be providing Narcan training at the library coming up in October and November. So these are free Narcan training that will be put up by the Alliance. Ms. Karina Scott, who is the shared service coordinator, will be working on other libraries to provide those trainings.
That's great.
That's great.
All right.
Chair Fishman, can I add one thing? And I think you might be better to address this about the newsletter that's been adapted.
Last year, the Central Mass Regional Public Health Alliance relaunched their monthly newsletter, and it used to come out in PDF format. And as of yesterday, it is now distributed through a master email distribution list. And I was able to obtain the link, which I will be posting under my Central Mass Regional Public Health Alliance newsletter button under the Health Department portion of the website, as well as previous editions. If anybody in the public wanted to look at what was done in the past, there's a lot of interactive information on the newsletter. There are clickable links and also QR codes as well, if people want to seek additional information on the subject matter that's provided. So we're very excited about that new kind of look and feel, and we'd love information, any other information from the public on what they would like to see in that newsletter, and we're looking forward to expanding our communications within the Alliance communities. Thank you.
Thank you, Carrie. All right, any other items?
It was just, Madam Chair, there was an outstanding item from last month where we talked about the infectious diseases reporting, and we were going to make
Oh,
some
yes,
amendments
CB.
to that. Do you know if there was any update to that?
Not to my knowledge. Not to my knowledge. I did bring it to the attention of the incident committee for the state, so I will follow up on that.
Great, thank you.
All right, I think next on the agenda is to schedule our meeting for October. I can't believe it's going to be October already.
I will not be here the 27th, otherwise I'm available.
Me neither, so that worked out well.
Thank you.
Do we want to do Friday the 20th?
It's fine with me.
20th works for me.
20th it is. Do I have a motion to adjourn?
So moved.
Second.
Agree by saying aye?
Aye.
Aye.
Aye. We are adjourned.
Thank you.
Thank you.